Application of the Orville for Dr. Glatt. Here's the package. Here's what the device looks like. This is what goes in the mouth first. This is at the end, the distal end. Always want to make sure this goes in. This is the last piece to go in. And this will have suture on, and Chrissy will show you how to do that.
So this is the suture that you need. 96 inches. I need a clamp.
And we'll say that the surgery techs will be putting this on for you, so most of the time this should be done before it gets to you, right, Chrissy?
Yes, but check it always.
Okay.
So it comes with a big needle. So you can use this to get it on too. So here's the Orville. The needle goes under both strings. Can you see that? Okay, so you should have one big long string now. Big long string. Okay, you're going to take one end and put it under both of the blue strings. See, there's two strings there. See, it's under both now. I'm going to feed it all the way through until you get equal ends here. See, all the way, okay? Now, he wants you to take the two ends and just tie some knots down there. There we go. There we go. Some knots down there. Let's see if I can get this here. There we go. Take the two short ends up here, like that. Two short ends, and then you put your clamp on the knot.
And will this be all done before it gets to you?
Yes,
Okay.
it should be, yes. So there's the clamp on the knot. And now what you have is one big loop.
Okay.
Okay, so now the important part when this comes to you is that you check this end and make sure that these sutures are pulled all the way up right there under both strings. Check that, because if you get it under like this, it won't come off. If you sometimes they'll have it like this under the Orville, that doesn't work either. It doesn't release. It's got to take both strings, make sure it's under both of them, and pull it up right there. Now don't pull too hard because it'll release the device, so just make sure it's seated right there. And then so when you insert this, he'll tell you when this needs to face the ceiling, face up. So you kind of take it like this and set all this by the patient's head, put that down, follow it down here, lube both ends really well. This end goes in the patient first when he tells you. So, you know, Dr. Glatt just likes you to talk to him, so you put that in the mouth just like a normal OG and feed it down. Tell him when you're kind of around the curve and tell him when you're coming down. If you get coiled up, that's fine. Just say, I'm coiled up, coming back, and then coming down again, going down. And you're going to get down to the stomach where they have sutured down there. And what he's looking for, you need to watch the screen because he's looking for it to get up right against that stomach and blanch right against that stomach. And then what's going to happen is that where it's blanching, he's going to burn a little hole through there and it's going to pop through. And then Tracy's going to grab this end and feed it out of the stomach, and she's going to pull and she's going to talk to you. And you're going to say, okay, keep going, keep going, keep going, keep going. And then when you get down to here, you want to tell her, say stop when it gets to the mouth, and she'll stop for you. And you take this Orville piece and you get it in their mouth, under their teeth and all that, where it's safe. And then I stick my finger on there and hold the strings kind of like that. Stick my finger in there, and she's going to say, you're going to say, okay, go ahead and start again. And she's going to start pulling again. You're going to just feed it down past into the esophagus, kind of past endotracheal tube balloon and all that. And then she's going to continue to pull that down. And that's going to go seat inside the stomach. And then they're going to do their thing down there and attach it down there and everything. And when they attach it, they're going to say, okay, you can go ahead and pull these strings out, and you're just going to pull them right out of the mouth. They don't cut them or anything. The whole thing will come out in one piece. And then you're done.
And then just to say what happens when they pull those strings, it releases, it actually pulls these strings out, tips this button on its side, and then these strings come out loose. Is that correct?
Yes, that's correct, yeah.
Okay.
No, that's it.